presentation today. I'll just remind everybody who's on the call and tuning into us today that the Q&A function is there available for any questions that you might have to ask arising from the presentations or anything at all that might be on your mind for the members of the management team. I think I might start the ball rolling with some questions that have been submitted in advance. The first one is on the waiting lists, which we know is going to be very topical this year. And I'm just wondering if we could answer this question. Are we concerned about any waiting lists in particular, or are there any areas in particular that might be an area of focus for us this year?
Sure. That's a good question. From a national perspective, they've done a capacity and demand analysis of waiting lists, and they have identified the specialties across every hospital group as to the areas that may be of concern with outpatients waiters. But we're very aware of that in the local group, and areas that would have been of concern would, of course, have been orthopedics, have very high long waiters, but there's significant work after being done on that waiting list with new consultants after being hired that validated the lists. In fact, we have a new consultant spine surgeon that started on Monday, Dr. Dawson, who's welcome to the group and did his first spinal and tumour surgery yesterday with Professor Lennon at UHL, which is a real change for us in the Midwest and very welcome. But aside from that good news, that is one of the waiting lists we're monitoring. ENT, ophthalmology, dermatology, maxillofacial are all very large waiting lists that people are waiting on the list to be seen. Our outpatients waiting list is the area of concern for us. We have over 58,000 people waiting. Our inpatient, the group has always been pretty at the top of the best rankings for inpatient treatment and day case treatment, but that challenge will come when the outpatients waiting list start converting into day cases. So what are we doing about it? There's over €250 million in the government funding to deal with waiting lists. We like to schedule as much as we can within our own hospital group. We call it insourcing of work. We'll be using the new theatres in Croom for that. But equally, we can outsource work through the NTPF model, through another model called advanced clinical prioritisation, where we're hiring registrars, etc., to help us validate our waiting lists, and indeed the use of the private sector, but to a lesser degree, because our access to the private sector is somewhat limited. We are using it for certain patients that will travel.
Thanks, Ganesh. There's a couple of questions in here on COVID and on the vaccination centres, and in particular in Nina and Ennis, they're operating, as we know, out of hotels. And as the country opens up, are we closing down these operations into hotels, and will work in the vaccination centres be affected or cease or something?
Yes, yeah, and that's a worry for staff. So we work in the vaccination centres. So I'm the chair of the Midwest Integrated Group, and we meet every second Monday now. It used to be weekly. So last Monday we discussed it. And the fact is that the vaccination centres are slowing down to a 3-day and a 2-day service from April, if everything moves in the right direction. But the staff working there, we still have other work to do. So the hotels do want their facilities back because, of course, society's reopening. There's a lot of weddings and different events that they need to now deal with. So we're currently looking at smaller vaccination centres for those areas that will deal with it. So we are looking at the outpatient facilities to see what we could factor in. The vaccination centre at Limerick is down the road, as you know, in a standalone unit in Squel Carmel. And we have leased that for another year, in honesty, because my view is that could be used as an off-site outpatients clinic setting where we can do some of the validation of the waiting list, and admin staff working in the centres can have access to that style of work. So the teams out in the vaccination centre, Patricia O'Gorman and Nora Barry, are currently doing a proposal for me around that, and we will study it again next Monday. So I hope that assures people a little.
That's great, Colette. And there's a related question then on vaccination. Is there any talk of healthcare workers getting a fourth dose?
No, straight answer. I believe NPHET are meeting tomorrow just to decide on the restrictions, but currently there's no indication that the fourth dose will be given to healthcare workers. They are looking at immunocompromised, of course, people, and are working up that, but they've seen the uptake is low in that realm. So we're also just doing a review of that to see why is it low, but at the moment there's no plan to do a fourth dose.
That's great. It's good to see our Q&A function is working. There's a question after coming in there from Breda about something that's been in the news recently. on if there's any truth to rumours about a new hospital for Limerick, a new elective hospital managed by UHL and including a second ED to be managed by the group.
Yeah, thanks for that question. Another good question. There's a lot of media on it at the moment, so I can tell you in honesty all the background to that. So there is an external party that has looked at Limerick with the Limerick City Council regarding building a hospital. They're known as UPMC, and they are working with the Limerick City Council about social housing model out at Cuna to deal with the need for housing, and alongside it they've offered to build this hospital. Their view is it would be a public hospital, that we would be affiliated with them as a hospital group, and that we would sit on their boards, and that they would build a 150-bed hospital to do subacute elective work. There is no ED planned for that hospital. It's at very early stages of discussion, but of course what we have our mind on as an executive team is that we need an elective hospital in the Midwest. So if we leave aside UPMC, who are doing external discussions, and think about what we need as an organisation, with the best will in the world, with the number of patients coming in through the emergency services, elective surgery gets pushed back, and we do need to pitch for an elective hospital. And with that, you have to come up with 3 options. And of course, our preference is to have a public hospital on public land. And we would also be looking towards our colleagues in St. John's, see if we can do anything there. So we're trying to lever that at the moment, but it's a big agenda item for us that we develop that. So UPMC, that model is there, it's being discussed, but it hasn't gone into the planning system. There's no agreement. That would be a government decision that we would be part of that, because in effect, there would be a Section 38 hospital that we would have to fund. I hope that helps.
Okay.
Yeah.
Thanks, Colette.